Welcome, everyone. I'm here with Councilwoman Renzulli, and we appreciate you tuning in tonight. It's a serious conversation. Obviously, it's something that's on the forefront of every conversation we're having every day. It's coping with COVID. And my name is Edward Brady. I'm a councilman in the city of Cranston in Ward 4. I'm also a small business owner that owns restaurants throughout the state of Rhode Island, one being Milk Money that's already closed, and Thirsty Beaver in Cranston, Thirsty Beaver in Smithfield. I have a restaurant in Rentham called Thirsty Beaver also, and I also own a restaurant called Huck's Filling Station. So I certainly understand the struggles that are going on a daily basis in our entire industry and our entire state. So as the COVID-19 pandemic continues to make an impact on our communities, and it can be a struggle to make sense of all the information that we're receiving on health and safety being shared on the news and social media, we thought it was important to have this conversation tonight from some trusted friends that we've known our entire life, who are also respected doctors and political leaders throughout the state of Rhode Island. With the rising infection numbers, not being able to come at more of a concerning time during the holiday season and the flu season, what information can we trust? What steps can we be doing, and what should we all be doing to protect ourselves, our communities, our physical, mental, economic, during these crazy times? Because we're all struggling, we're all frustrated, but it's important to have these continued conversations to help each other get through this. To help answer these questions, I have a respected colleague and fellow councilwoman, also a lifelong friend, Cranston Councilwoman Nicole Renzulli. She's here to help host this community conversation, discussing the continued challenges of COVID-19. Welcome, Nicole. How are you doing tonight?
Good, Ed. How are you? Thanks so much for having me join you on this important conversation. I'm excited and honored to introduce two medical experts that are here with us tonight. Both of them went to high school with us, and I'm really excited to get their opinions and their expertise on everything that's going on with COVID. Like you said, everyone is struggling, and I'm really excited that we'll be able to do this tonight. So first, I want to introduce Dr. Kenneth Perry. He's a Rhode Island native, and like I said, a 2002 graduate of Cranston West. He joins us from Charleston, South Carolina, where he's an emergency medicine physician who also works with various media outlets, translating medicine and medical topics such as COVID-19 to help people really be better advocates for their own health. So Ken, thanks so much for being with us here tonight.
Thanks for having me.
And I'd also like to introduce Dr. Alex Turchetta. He perhaps a very important and under-discussed element of COVID-19 is how it affects our mental health. Alex is also a Rhode Island native, graduate of Cranston West, and he's a licensed clinical psychologist who provides services to both adolescents and adults suffering from a wide range of difficulties, including anxiety, depression, ADHD, OCD, weight problems, and behavioral problems, as well as addictions. Alex, thanks for joining us tonight.
Thanks for having me. It's great to be here, guys. Good to see you.
Thank you, docs. I appreciate both joining. Obviously, I've known you both my entire life, and it's truly appreciated that you're taking your time tonight on a Friday night to discuss these important issues. And I'm truly proud of you both, and I've obviously watched you both grow and empower and uplift the community. And in times like this, when we're all struggling mentally and physically and economically, I think it's truly important for people like yourself to tell us the facts, tell us how it is. And I just want you to know both how much I appreciate you and respect you, and I'm thankful for you both on tonight.
Thanks, guys, for that warm welcome. Appreciate that.
Thanks for having us.
Yeah, absolutely. And then last but not least, I'd like to welcome someone that I've had the pleasure of getting to know over the last few months. And in a time when, we don't know what to trust, and, we're, getting pulled in many different directions. The Lieutenant Governor, Dan McKee, is here tonight to discuss this pandemic. He's been, just to kind of give you a brief history on him and myself, is I reached out to their office because at a point I felt like I wasn't being heard or returned calls by anyone. And their office was very responsive. They got back to me immediately. The Lieutenant Governor jumped on a call with me for about an hour and listened. And I think that's what a lot of us want out of our leadership here in Rhode Island. And he's out there on a daily basis doing small business tours throughout the community, and he's touching businesses, and he understands our struggles as a small business owner himself, and as a former mayor and as a former city council person. And the lieutenant governor's office in the past, a lot of people have said, is that position really needed? And I think he's shown us all in the small business community with his continued fight, asking for COVID cares relief funds to be released by the governor, continuing to host rallies to get those funds released and back into the community. I'm a registered Republican. I'm a Republican councilman here in the city of Cranston with Nicole, and Mr. McKee is a Democrat. I think he's showing us on a daily basis that party doesn't matter. And right now it's just all about unifying and getting through this pandemic together. So I've learned to gain a lot of respect for him. I really appreciate his message. I appreciate his leadership. I know how tiring it must be, but I truly appreciate him also being here on the call tonight to give us a little bit of perspective on some of the efforts that their office is doing and things we can all help each other do throughout the community. So Lieutenant Governor, thank you for being on tonight.
Yeah, thanks
Thank
for the
you,
invitation. Thanks for the invitation, Ed and Nicole. Happy to say hello, and I'm very looking forward to hearing from the docs in terms of this really important issue.
Lieutenant Governor, can I ask you obviously we're getting a lot of information on social media and, in the news, and we don't know what to believe and what not to believe. Trust, I think, is a very important element in leadership, and you've earned our trust by being out there with us day by day, asking the questions on these small business stores. What do you think we can do more as leaders to help medical professionals that are on the call like tonight make sure that the information is getting out there and staying safe?
Yeah, I think it's so important to be listening to the medical advice and the science of the issue, and then really reflecting as well in terms of our personal lives. What's happening in terms of people that are close to us and friends of ours and family members, and the illness and deaths that are going on, and so we need to really take it serious. But I also think that Rhode Island is in this for the docs' benefit, Ken and Alex. We're starting to do these community forums, Ed, and I think that we're going to be doing something in Cranston with you and the other leaders. But we are trying to bring in the community and start listening to the community, and then supporting the leaders that need to be managing from the top down, but we need to really get into the grassroots from the bottom up. And so that's what I think. I think when we're at an infection rate that is unfortunately, we're sending a woman to the moon right now, and if we were on that flight, we look back on the world and look at the highest infection rate in the world, you see a red dot and on 100,000 people in the state of Rhode Island. So I think when you're in the middle of a pandemic like this, as a leader who's managed through a crisis through 9/11, I kind of liken it to that. We're at a crisis. We have this real organic type of a gathering of our community. I reached out to our clergy, created some very strong public sessions so people could come. I think that we're lacking that community, response like in 9/11 that really rallied around a crisis. And I think we need to reach out to people that are, leaders in communities, not only elected leaders, but your Rotary clubs and your Boys and Girls clubs and your Ys and your churches and your hospitals and the list goes on, because I think that they have more influence at this point in time than anybody has. And so we have to centralize the message, use good advice that's coming from medical people, and then also understand that we need to have empathy in terms of, there's some people who, quite frankly, need to get out. They need a paycheck. They need, to have that social interaction. They need to be in their churches. They feel a need for it. They need to go visit family members that they really are close to in terms of a social, need. So we got to realize that not 100% of people aren't going to comply. Some people are not going to take any risk, but that's fine. But those who take some small risk or larger risk because of circumstances they're living in, we got to coach them along in terms of how to be safer. So I think that's our effort right now, Ed, is to start these community sessions. We had one yesterday in the town of Westerly, very well attended. And now as a result, Ben, who's helping you produce this program tonight, I'm anticipating, based on the call, that there's going to be a centralized message that the grassroots organizations are going to be able to embrace, and then they're going to be able to feed up through their organizations that support of their leadership that is, agreeing on this one centralized message. So that's a long-winded thing, but we've got a high infection rate. And I think when you're in that spot, you got to be willing to go back to the drawing board. And that's what I think that needs to be done right now. We need to go back to the drawing board and think about a different approach, because the one we have going on in Rhode Island right now is not working.
Lieutenant Governor, I think that's truly important, and I think the aspect of trust has to be earned, just like any other friendship, just like any other relationship, just like anything else in life. And what the efforts that your office and that you are doing is earning trust in communities every day. And I certainly appreciate those efforts. And why that's important to me is, obviously, I think it's crucially important that we all are allowed into a conversation to get through this, and it's not a one-person effort, or it's these conversations, these town halls that you're hosting on a weekly basis are imperatively important to getting through this virus. So I truly appreciate your continued efforts. Thank you for including us, regardless of
thanks for the
political party.
invitation. Wait, listen, I kind of say that this is not a high income, low income, moderate income issue. This is not a minority, non-minority issue. There are certain segments of our populations that are more impacted, and we got to realize that. But it's a general message. I liken it to 9/11. If you can recall back 9/11, you guys were a lot younger than I am, but there was a rally that happened in our communities and communities all around the country around that crisis, around that attack. We're being attacked. It's just not a terrorist attack, but it has the same elements in terms of how it's impacting our state, both emotionally and economically. So thanks. I'll sit back and listen.
Excellent.
Yeah.
Dr. Perry, thank you again for being on tonight. I certainly, I know that on many sleepless nights, I've just, as a trusted friend and someone I've known my whole life, sent you some Facebook messages and being like, what's going on out there?
Right.
You being on tonight, I think is really, it's important because, like I said earlier, there's a lot of information that we're getting on the news and in the media, and to be able to go to a trusted friend and ally who I've known my entire life as a man of honor and a man of hard work and respect, you always get right back to me, and I can only imagine what your days are like, and I know how tirelessly you and your entire community are working. So I truly appreciate it, full-heartedly. I think tonight I would like to hopefully maybe debunk some of the myths. I know a question that I've asked you in the past is, are hospitals really at 100%? Why are people not believing that? I know, we touched base in the past about them being at 50% and hospitals needing to be at 85, 90% because they're profitable. Can you give us a little insight without violating HIPAA laws? What's going on out there?
Sure. So across the country, this has been an issue. We're sort of letting you inside baseball on this one. This is how hospitals work all the time. We have, unlike a hotel, this is actually sort of the discussion you and I had, unlike a hotel that always likes to have a few empty rooms because you're able to move your guests around, hospitals don't really want to work off of that. They really need 100% capacity or near that in order to make sure that they're a well-oiled machine. It's how we know how many nurses we need. It's how any hospital knows how many techs, how many physicians. We staff based off of how many patients we have. So the concern, and why this is such a discussion that we're having right now, is that back in March, many hospitals actually started looking at their staffing and said, we're not doing elective surgeries, right? This is a discussion that lots of hospitals had across the country. They minimize their elective surgeries. They tried to minimize the number of people coming into a hospital for no reason. What that did, however, was it actually reduced the number of patients coming into any hospital. And this is not here. I'm not speaking of my hospital. I'm speaking sort of in general brushstrokes. And that meant that we just didn't need as many staff. We didn't need the nurses. We didn't need the techs. But now, as patients are starting to come back for whatever reason, whether it be they're finally coming back for their, I've had patients who are waiting at home with complete paralysis of the side of their body for a week. And they're finally coming in saying they're afraid of getting COVID, but they think they might have had a stroke. Or, they have this cough and they think they might have coughed up some blood 6 months ago, but they were too concerned to get COVID. And they come in and we have to tell them that they've got lung cancer. So now patients are coming back. We just don't have the staff. And this is not a we as a specific we to where I am. This is sort of a hospital we, in the sense our staff has gone elsewhere. They've gone to either COVID hotspots at the time, or they've certainly figured out a different way to definitely look at the different ways of working. There's telehealth, there's different options. So this is something that we're now just starting to see, because we now know so much about this, but if you think back in March, this was such an unknown to us. It really became very difficult of what we were going to do.
So on that point, Dr. Perry, I know that we talked earlier on about losses at the beginning of this virus, and the evolution of how the treatment care has gotten better, especially early on putting on respirators too early. Can you touch base on how
Sure.
you guys are handling this better as a community, and what we know now versus what we knew at the beginning?
Absolutely. So in March, one of the things that's really interesting about COVID is that patients can come in and absolutely get vital signs that are really concerning. Their oxygen levels are down in the 50s, 60s%. And we just didn't know what to do with that. So initially we thought that required a patient to be intubated early. And so if we look to Italy, if we look across the world, patients were going on ventilators. Those are the videos that you saw, the sort of heart-wrenching videos of all these patients just on ventilators. We then realized that there's things that we can do without putting them on ventilators. For instance, one of my attendings I used to work with in New York City calls them sort of happy hypoxics, meaning they're patients who look normal, but their oxygen saturation, which should be anywhere from 95 to 100, is sort of down in the 50, 60, 70% range, but they don't look in distress. If you just put them what we call prone, basically meaning lying on their stomach, all of a sudden their symptoms get better and they feel better. And so we figured out things that we could do. The other thing is that we started to realize how it was transmitted, and we realized sort of where we needed to put the onus. If you think back, we really thought that this thing lived for weeks on door handles. And as much as any virus does, the reality is it's all about sitting within a certain distance of people and interacting with the respiratory droplets. So we are learning more about how it's transmitted from person to person, which is giving us a way of preventing them. And then even once they are symptomatic, we have different ways to treat them, even beyond getting into some of the more experimental things that are sort of in the news.
So that's a great point for me, Dr. Perry, because, a lot of people are saying, well, what does the CDC know? What does the Department of Health know? They're seeing the evolution of, the changing of these rules and the time that we're keeping people, quarantine and whatnot. And I would imagine that's from learning more and more about this virus. Is that fair to say?
I think one of the things that's really difficult for the general public is that, you do 4 years of medical school. I did a 4-year residency. In that time frame, you learn about different studies and you learn how to look through sensitivity and specificity and how to change recommendations. And for the medical community, we don't change and sort of no longer trust an entire branch of, say, if the CDC comes out with a guideline that then turns out to be not right, we're able to put it into perspective because that's sort of what our training does. But what we've asked the general public to do is take their background knowledge of science, which might not be sort of, what it needs to be to understand these sort of changes that are occurring and feel comfortable with these changes. I mean, it's so unnerving to one day say, we don't need a mask. And then the next day you must wear a mask everywhere you go. One day, there's no treatment for this. And then the next day, oh, don't worry about it. We're going to do this. If you take this medication before you get it, you won't get a really bad outcome. And then turns out that actually can worsen your outcome. So these are things that we're used to within science, but we're because it's such a concerning thing, we've actually let people in on the day-to-day changes, which might actually add to some of the anxiety, which certainly Alex can talk to. The fact that people just don't know what to go off of. It's very difficult as a medical person to give recommendations and feel comfortable with them when people are going to doubt you tomorrow if that recommendation changes.
Absolutely. And, I'll defer to Councilwoman Renzulli to ask additional questions to Dr. Turchetta. But my last question before we get on to community questions later on, Dr. Perry, and questions from this panel is, what advice right now, knowing what we know now with the evolution of the knowledge, and what advice would you give to people as this virus continues to be widespread, and understanding the struggles that people are going through on a daily basis, both economically, mentally, physically? I mean, we were seeing here in Rhode Island a community that's exhausted, rightfully so. Teachers that are crying from teaching both virtually and teaching live in a classroom. Healthcare professionals that work in 70, 80 hours a week to keep people alive. I mean, across the board, us as small business owners seeing mandates being inconsistent and becoming frustrated as we watch revenues decline. At a time that, our community needs uplifting more than ever during a holiday season. We're now 9 months into this virus that we all believed would be gone. What advice would you give to that community medically? Because we all need to buy into something to help this virus end.
I think one of the things is we have to be really appreciative of how amazing, just as a community, as a national community, if you think about it, we're discussing 2 possible vaccines here, right? So in the last few weeks, we have 2 vaccines that have come out, and one just got emergency FDA approval. And at the same time, we're learning more about how to prevent. So I think initially we were really concerned about mask ordinances and things like that. But we see now that the science and the data supports communities who implemented mask on dates or sort of require masking in order to go into public places have lower occurrence of these of outbreaks. At the same time, as I work in some hospitals that are pretty rural, and people who, as the Lieutenant Governor was hitting on, this is not only is it not a minority or not as it's, Republican, Democrat, it's also not state by state, right? So I have patients who, if they cannot get to a store every day, they don't have the capital to do 2 weeks of a lockdown, right? So lockdown sounds great, but it literally has to be every single person for the entire duration. And I have patients that just can't do that. So as soon as you can't do it, it's really difficult to use that as the only recommendation, because then you sort of set the bar there, and anything less than that is either sort of a failed society member, right? So there's these patients who are still going out because they have to, getting that concern, and family members saying, hey, you're going out, I don't want you around me at all. So I think we have to realize that we live in a country that's able to get us a vaccine that, we can discuss that at another point as well, but 2 vaccines, possibly a third one, at the same time as we realize that as long as you are wearing masks and really not in really high density areas with high density of people, and fastidious mask wearing, meaning, the under your nose isn't going to help you, under your chin, that kind of thing. So I think if you're doing that, I think this is we can sort of get through this and get to the point where we're able to roll out something where we can look back and say how bad it was, not how bad it is.
Thank you, Dr. Perry. Councilwoman Renzulli, would you like to start the conversation with Dr. Turchetta?
Yes. So Dr. Turchetta, really, a lot of people have been asking lately, how mental health plays into COVID. So we know, you have COVID and the different symptoms that you're going to run into physically, but mentally, how can we protect ourselves and those we care about in regards to our mental health through isolation is causing trouble? Kids who, aren't seeing their friends, aren't going to school, can't play sports. How has that influenced your practice? And what are your suggestions?
Hello?
Alex, can you hear me?
Can you guys hear me?
Did you hear my question? Okay.
Yeah, I heard it. Yep. Yeah. So first of all, I think, the biggest thing that's causing anxiety at this point is just the uncertainty. it's kind of the torture of the unknown at this point. There's no end date to this at this point. There's no definitive date. So there's this unknown, and when there's unknown, there's uncertainty, there's a lot of anxiety, there's a lack of control. So people are feeling out of control at this point. If we had an end date, say, this was ending at February 2nd, we'd start to feel a little bit more in control. We'd be able to prepare. We'd be able to kind of wrap our minds around that a little bit better, where, we'd be able to plan for that. But because of that lack of uncertainty, people are really experiencing that anxiety and stress a lot more. Also, two of the biggest things that are happening during this pandemic are, this pandemic is actually mimicking two of the biggest symptoms of depression. So, it's isolation, and it's, lack of ability to engage in typical activities. So those are, two of the biggest symptoms of depression. So this pandemic is actually mimicking a lot of the, those depressive symptoms. So naturally, people are feeling anxious, they're feeling depressed, they're feeling frustrated with the kind of arbitrariness of the rules. Why is this place open? Why can't this place be open? There's a lot of anger and frustration there. People are losing their jobs, people are losing their benefits. Is their job going to be there when this is all over? Is their business going to be there when this is all over? So now that you have that that financial uncertainty as well, causing more stress and more anxiety. So there's a lot of stress and anxiety that are happening right now. On top of that, kids are being affected from this because they're unable to socialize at this point, and we know that schools isn't just a place for academics; it's a place for learning social skills, learning competition, cooperation with other people, with other kids, learning how to interact with others. And that's one of the biggest things at this point. So that's being affected as well. Also, there's been increasing reports that mental health is on the rise, mental health issues on the rise, substance abuse is on the rise, domestic violence is on the rise. There's a study I saw that showed that estimated that there's going to be an additional 75,000 deaths related to suicide, drugs, and other contributors. So alcohol is on the rise. All those type of negative vices that we're going to kind of cope with this stressful time at this point. So those are some of the things that we're experiencing at this point.
Hearing that, Dr. Turchetta, it's obviously important as us as a community to check in on our friends and our family and those that we truly care about and make sure that, they are okay, right? I mean, these are tough times for everybody.
Sure. That's one of the biggest things, honestly, is identifying, knowing who's more susceptible for depression, for anxiety, reaching out to those people, supporting them and encouraging them to go get help. That's one of the biggest things at this point, and having a supportive relationship is one of the biggest protective factors for suicide. So if you know of anybody who is struggling right now, make sure you're reaching out to them, getting them some help. Some other things that we can do is, and I'm sure Ken can attest to this, making sure that your physical health is also up to par, because physical and mental health are not mutually exclusive. Prioritizing your sleep, proper nutrition, exercising, meditating, all these type of things. So making sure that those are a top priority, because when they're not, you start to feel more irritable, you start to feel more anxious, your regulation skills go out the window, and you're more susceptible for mental health issues going forward. To that end, also finding a purpose in this time. These times of trying, finding a purpose, finding a meaning for your life during this time, whether that's going out and supporting others, or developing a skill, or creating goals for yourself. Routines and structure throughout this time are paramount, especially for kids. Parents, making sure that your kids are in a routine and structured, and they're sticking to that routine. Accountability is paramount in this as well. Also, I would encourage people to go out and engage in therapy. It's never been easier at this time. So you just, from the comfort of your own home, you can sit on your couch, you pop on a computer, you don't have to drive anywhere, and you're linked up with a therapist. So if you've ever been thinking about trying it or wanted to try it, now's the time to do that. So that's fantastic. And then also, finding creative ways to be social. We're social beings. It's part of the fabric of our lives. It's we have an innate need to socialize with other people, and finding creative ways. We have to socially distance at this point, but finding creative ways to do that, whether that's through Zoom, through a conference call such as this, just FaceTiming with a friend. Kids can go online and play games on headsets nowadays. We didn't have that back in the day playing Nintendo.
Mhm.
We're kind of isolated doing that. But nowadays they can do that. You can watch Netflix online with other friends, things of that nature. And it's really it's really a great thing that we're able to do that at this point.
Fantastic. Thank you. And going back to the vaccine, which I think that Ken will also jump in and talk about the vaccines. Alex, the mental aspects that relate to vaccines. There are, some people who say they are 100% not going to take a vaccine and have certain fears and anxiety, based on what they see in the news or what people are discussing on Facebook. What do you have to say about that?
Well, the biggest thing is that there's so much misinformation that's being disseminated on Facebook and social media. I'm going to, wag a finger at social media in general, just because, the divisiveness, with this vaccine, it's become politicized. Who views it right? Who views it left? And social media is really feeding into that. And they're kind of exploiting our confirmation bias at this point. So what the confirmation bias is, people seek out information that coincides with their already pre-existing beliefs. And unfortunately, social media's algorithms, they put information in front of you that just consistently, just kind of confirms those beliefs. So you're not seeing the other side. You're only seeing this one kind of very narrow filtered view. And you look at the other people on the other side who are getting another completely different view, and you're saying these people are crazy over here. How could they believe that? But we have no consistent unbiased information at this point, and unfortunately, that's it's terrible. So what Lieutenant Governor is doing with that grassroots program and going out to the community leaders and getting people to buy in and getting their perspective and getting them to kind of co-sign on that is fantastic, because what people want to do is once they say something, they want to be consistent with the things that they say. So if you're actually getting their opinions and getting their feedback, they're going to be more likely to buy in with that. So that's fantastic that we're going that route.
Great.
I couldn't agree with you more, Doc. And to touch base on that, you have parents that are now teaching children at home. They're exhausted. They're working. They're wondering if their kids are getting the same education. You have teachers and superintendents and people throughout our entire learning community that are frustrated and looking for relief. So some of those points that you brought up, I think, are truly important, because just having a conversation now and challenging, debunking things that we're seeing on social media is important, because I think it's important that we continue to look at the facts and challenge it, even if it's real, if it's not, and have a conversation collectively as a community like this, and come to a compromise with a resolution and unify, like the Lieutenant Governor was saying earlier, much like after 9/11, because we all have to unify behind a positive message. We all have to unify behind something, and the only way to do that is touching base on what you said earlier, Doc, is having these conversations, is having these grassroots campaigns like the Lieutenant Governor is talking about, getting out there in the churches, getting out there in the community, having our elected leaders talk to doctors, being out there, being transparent, showing and understanding the perspectives of the teacher, of the doctor, of the nurse, of the mom, of the dad, of the leader. I mean, we're all exhausted, but you know what? We're exhausted together. So we have to unify behind these messages, continue to educate ourselves, and drive forward. Nicole, I didn't mean to interrupt again. I apologize.
Oh, no, that's fine. So Ed brought up a good point, Alex, about I speak to a lot of mothers. I'm a mom of 3 and I'm home, and we're in a transition of local leadership, so I'm doing a lot of work with that, plus with my own job, and I have 3 kids at home, and it's stressful. And I hear other moms and dads saying, like, how long is this sustainable for? What advice do you have to help parents who are home working and also taking care of their children of a variety of ages, trying to keep them healthy, both mentally and physically, and educate them at the same time?
Yeah,
how can they work on their mental health?
It's a struggle. So what we need to do is as parents and educators is you have a hard job. You're juggling 2 things that are going on at once. Just keeping them in front of the screen and being educated, but also keeping them safe. And you also need to kind of continue to do your own job at the same time and keep yourself safe. So one of the biggest things that you can do is, engage in self-care. Engage in self-care is going to, once the kids go to bed, put them to bed, develop, engage in some relaxation techniques, relaxing activities, whether that's reaching out to other people, journaling, painting, practicing gratitude, developing hobbies, working on a skill. Those things are going to be paramount in trying to keep ourselves sane for however long this is going to be, be going on for. That gratitude piece is paramount as well, because, I think that's going to be one of the biggest things that may be a positive that's going to come out of this pandemic. I think we've taken a lot of things that, we typically just take for granted, especially socializing with other people, little things. So our personal freedoms, we've taken them for granted for so long. Hopefully, once this is over, we can start to feel better and be grateful for some of the things that we just granted.
Lieutenant Governor, do you have any questions you want to ask the doctors?
Yeah, I'd like to ask Dr. Perry, Dr. Turchetta, that, I was taking Alex's advice today. I went out and played 9 holes, so that's why I got my golf sweatshirt on right now.
There we go.
Which was first time in too many days that would gone by without getting a little bit of that type of relaxation. So I do, and being a former small business person of a health club, certainly buy into the things you're talking about. I got, I guess the question, Dr. Perry, Dr. Turchetta, so we know that, and I have it right in our own family. We have some people who are extremely strict about their behavior because they want to have zero risk. But then we also have people who take some form of risk, as I was saying before, maybe because they don't have a choice. They need a paycheck, like I said before. Others might take a risk around that may travel during Christmas time, right? They're going to travel. Millions of people won't, because they're going to take that zero risk type of strategy that some of my family members have taken. But many people are not going to do that for whatever reason. So what is your advice to those who see a need or actually have a need? Many people want to go to church. They want to receive communion. They want to interact with their pastors in a way that they're not doing right now, and for all the reasons that Alex just said. So some advice. I'm not saying you're endorsing the idea that behavior is good, but what I'm asking you to do is that when we recognize that behavior is going to happen, what advice can we give to those people who do take a small amount of risk, or even in some cases, how do we tone down those who take too much risk to get them, down on that risk taking?
So I think one of the things, Lieutenant Governor, that I have tried to explain to a lot of patients, and also to some people and friends across the country who also work in emergency medicine, there's this view that if you do anything beyond stay home, you are part of you're doing this as a cold-hearted gesture because you want to actively hurt someone. And, that doesn't really reflect, as you were saying, and as I have experienced myself, in my professional life, that doesn't reflect the reality. There are some things that just have to happen. The other thing is that I think from a medical side, there are certain populations that certainly are going to have a higher risk associated if they do contract COVID-19. Obviously, everyone has a possibility of having some of the really horrible outcomes that we're seeing, but many people are asymptomatic from it. So what we have to remind people is it's your risk if you want to go and partake in some of these things. The issue is, once you have done that, who will you be around? To whom are you going to be the risk for? And I think that is at least what I have been talking about in the emergency department. These are the same things. Gosh, if I could advise people to do what I say and then they wouldn't have a medical problem, many of the antibiotics I give and many of the recommendations I give for smoking cessation would probably be followed. And I know from a fact that they're not, right? So people are going to live the life their way. We just have to give them enough information of how much risk they have and how much risk they're putting towards everyone else. And from a paternalistic standpoint of telling someone not to do something, to more of bringing them to the understanding that, hey, this is a risk that might not be a risk for you, but probably is a risk for grandma or your aunts or your parents. And you kind of have to talk about that. You don't want to be sitting there and not explain that risk when you do get together with someone.
Yeah, I definitely echo those sentiments. And yeah, I would say, people need to have a personal responsibility, for themselves. If you, like Ken was saying, if you go out and you put yourself at risk, please don't go around anybody else. Also, I think that people are getting kind of frustrated with some of the rules because, I said it before, the arbitrariness of some of the rules. When the pandemic first happened, they shut down some of the parks. I remember going to Cranston West track, and I was literally the only person there. And all of a sudden, a cop came zooming by and said, "Oh, the track's closed." And I was like, "Wait, I thought we were supposed to be socially distanced." And so I think some of these rules are the arbitrariness of the rules are causing people to be frustrated and angry. And instead of saying, "Okay, well, I get it," they're throwing out all the rules at this point. Well, these rules are stupid, so I don't want to follow them anymore. So I think that's part of that, what's causing people to be frustrated and angry at this point.
Lieutenant Governor, do you mind?
Ed, one of the things that came up in in that first session, I'm going to be in Central Falls next week, which is for our state, it's one of the heaviest infected areas because of the density, and also many of the people who live there are at risk because of their jobs, which are first generation jobs, right? So they happen to be in first generation jobs, which requires them to not be able to work from home in many cases, right? So, but one of the things that was brought up in the session was this notion that there are deniers out there, and those deniers, how do you deal with them, Dr. Perry and Dr. Turchetta? There's some people we were just talking about some people who are willing to take a smaller amount of risk because of necessity. We talk about some people who will take a larger amount of risk, and you're talking about let's educate them and tell them the downsides of taking a larger risk than they should. What do you do for the people who are in the category of deniers and the impact that they have on community as a whole at this point in time?
Ken, you want to take that one, or do you want me to?
Well, sure. I can start. So I think one of the things that you have to realize is that it's so difficult to have that discussion now. It was easier to have that discussion in March when there were some unknowns and there were things that people just didn't understand. So to sit in that, either the silo of it doesn't exist or the silo of every single person who gets it dies, both silos are wrong, right? I mean, that's the reality. The reality is never so black and white. You either don't exist, it doesn't exist, or every single person who gets it. I mean, I've seen many people who have recovered from it, which doesn't play towards the other extreme as well. So I think what we have to understand is where the reality is where we have to be. You have to, as a medical community, we have to start looking at how do we get people to not live in fear, because fear can manipulate, and fear of the unknown, exactly what Alex was talking about, that unknown, that what's coming tomorrow allows people to be pushed one way or the other. And so if they're in these social media groups, if they're in these groups where they're not seeing or interacting with people who are somewhere in that middle ground, that's going to be our issue. I still have patients who get into traumas and not wear a seatbelt. So to answer your question, there are some people that you're never going to be able to convince. So you just have to minimize the societal public health risk. So I think the masks in public places and being able to understand how it's transmitted at a community spread level would allow us on a community level to sort of minimize those things.
Yeah, I think it comes back to that personal responsibility again. So, someone, and I haven't personally seen anyone who just denies that the virus exists or anything like that. But, someone who's saying, okay, I'm not susceptible, I'm not at risk, fine. But if you're putting other people who are at risk, if you're going around people who over a certain age or who have pre-existing conditions, you're now putting people at risk. So you need to be accountable for that, which is, so it's one thing to go out there and be on your own and say I'm fine with the risk. Okay, that's great, but just you shouldn't be putting other people at risk.
Thank you.
And I was wondering if we could just touch base quickly on the vaccine issue. I think this is a good sort of transition. It's difficult to get people who don't believe that a virus exists to take a vaccine for something that they also don't even believe exists. So also get them to understand and feel comfortable with how quickly these vaccines occurred and how quickly they happened, because we all know, there's all over social media. If we're able to get a vaccine for COVID in 6 months, how come, and fill in the blank virus that's been around for years, how come we weren't able to do that? Part of it has to do with what kind of vaccine this is. Many of the vaccines, there's probably some people who are watching who can't take vaccines because they're allergic to eggs. Vaccines for years were actually, you inoculate an egg and then you take the proteins from there, you make the vaccine, and that's how you get people to be immune. These vaccines that we're talking about are actually what's called an mRNA virus. If you remember back from biology over there at Cranston West, that is the DNA RNA protein discussion that you probably all
you remember it. I don't remember.
Really, yeah, and are probably sitting there going, "What are you discussing?
What are you talking about?"
Yeah. So Mr. Riley is sitting there somewhere and wondering why we're still discussing it. But what's happening is, instead of taking the vaccine, injecting the vaccine, which is either a live attenuated or a dead viral particle into patients and allowing their bodies to create the antibodies, science has figured out, hey, this code, this mRNA code, this is the messenger, this is the message that we want the body to know, and we want them to create the antibodies to it. And that actually is not the first time that it's been used. It's the reason why it was so quick to roll out. There's good studies looking at even these types of vaccines against breast cancer and against other types of cancers. So this is why this was sort of at the forefront of a lot of the science across it. It doesn't take the time frame that the normal vaccines take. It doesn't take putting it into an egg, waiting for it to culture, waiting for it to grow, and then harvesting it and putting it into a vaccine. This is just a protein. They're making a protein in the lab that is going to make your body create the antibody. And that is how quickly it has come out. There's a New England Journal article looking at the Pfizer vaccine, not to bore you, but the numbers are pretty awesome. 95% efficacy after the second round. It's a 2-shot injection. I have no stake in Pfizer, so I'm not saying it from a saying one way or the other. I'm just saying this is the study that has come out most recently. And so this is something that we are able to get back to normal life if we get it. 95% efficacy with minimizing serious risks. Even the allergic reactions that people had, those patients actually had pre-existing allergic conditions that required EpiPens anyway. So there are great strides within science that if we can get people to understand that, hey, there is this virus, it's causing havoc against in specifically certain populations. And we really would like you to, if we can, get this vaccine and we could probably get back to normal life. I think that information, if we could get that out, that'd be very, very helpful.
Okay, quick question on that. Now, what is the percentage rate of the population that needs to take is it 70% in order to achieve herd immunity?
Yeah, roughly 70 to 80%. This is this conversation, but in reverse is what's been happening for the last few years of everyone not getting the polio vaccine or not. The MMR and measles, mumps, rubella vaccine. This is why you have the measles outbreaks in certain populations. So once you drop below that, the virus can take hold. And that's sort of one of the major issues. The other thing, and this is to answer the question of why this has gone on for so long, the sort of secret is that we knew it would go on this long. If everyone followed the directions back in March, it doesn't minimize the number of cases. It minimizes the area under the curve, right? So when you draw the curve of how many people have it, it doesn't change the number of people that are going to get COVID. It just you try to minimize how many people have it at one point in time, because that is speaking to sort of the capacity issues that we know about. So it has to last this long if we did what was right along the way. So that is that sort of, I don't know, dirty little secret of the whole thing, is that if we followed those instructions, this is what is supposed to happen. You know, at the same time as we now need to get people so close to knowing that this is the next step. We need to get people to take this vaccine and hopefully move on to that next step.
Sure.
Dr. Turchetta, I know you touched base on, you know, being physically fit. That certainly obviously helps get through mental health, everything, you know, balance. But Dr. Perry, what can people also be doing to build up their immunity beyond getting in shape? I know I take zinc. You know, I've heard different things out there. Is there any recommendations that you have for people to build their immunity through this?
So there's two things. One, I think anything that can increase your immunity is not a bad thing, right? I'm never going to sit here and say that's not, but I want to be really very honest and say that's not the answer to COVID-19. What's the answer to COVID-19 is minimizing your risk of hypertension, diabetes. You know, as Dr. Turchetta was talking about, this is what's happening, right? So people are staying at home, they're drinking more, they're eating more, their blood sugars are higher, they're not as healthy. So yeah, you could take extra things, zinc or all these other immune sort of boosting things. The reality is it's masks if you're in a public space, and knowing what your risk profile is, which is going to be very different for every person, and it's already in place, right? So if you're a diabetic, if you're a hypertensive, if you have multiple, if you take anything that's going to cause you to become immunosuppressed, you're in the risk pool, and there's nothing you can do beyond keeping yourself from being exposed to it that really is going to have any real true efficacy.
That's you know, that's some good information, because myself as a small business owner, and I know that the Lieutenant Governor has been obviously lobbying and continue to get out our message as a restaurant community, as a gym community, and you know, as we see this virus become closer and closer to home, and my mom herself was just released from the hospital after spending time in there, and a lot of us are seeing, you know, 1,200 cases a day. We're seeing friends and family get it. We're seeing it more directly impacted. And I think we're all understanding more of the severity of the virus. But at the same time, as a small business owner, as I see less and less in revenue, and, you know, I get more and more frustrated seeing hypocrisy of mandates and malls packed, and, you know, Garden City Shopping Center packed. You know, I'm continuing to play by the rules, because I'm looking more big picture. As tough it is right now to survive, and, you know, I could certainly just break it and say, I'm not going to listen to these rules. I'm not going to wear masks anymore. I'm not going to play by the rules. But I know that if we continue to do that, we're never going to find an end. If people don't buy into, I myself personally, I know there's a lot of, you know, you answered a great question regarding the vaccine that I had for myself. You know, where am I going to take it? I need to buy into anything right now, because I need to go back to a life of normalcy, you know, for the same reasons that Dr. Turchetta talked about, of mental health, of getting through, of, you know, and I think that's how a lot of society feels right now. And, you know, I think that's why this conversation is important, because like we've discussed earlier, there is a lot of misinformation out there. So as long as we can continue to educate, get out there, tell truth, I think that these conversations help greatly. I know we have about, believe this goes for an hour. Is anyone else have any other questions, or do we want to go to some of the community forum questions from here?
I just make one point, and then we can go. Sorry, go ahead, Alex.
I had a question for you, Ken, actually. So, you know, just in the interest of misinformation, I know that the studies are fairly new. The Pfizer studies and the vaccine studies are fairly new. You know, do we know, because I've seen some misinformation on Facebook and social media about what the side effects of the vaccine are. And I'm not sure. I don't think the population, I don't think the general public knows what those are.
No, so that's and that's actually what I was going to speak to. So this is really good. I was going to say that, you know,
perfect segue. Look at that.
It's adding to that. So people are watching two things daily, right? They're watching whether or not Pfizer and Moderna and AstraZeneca and all these others, if they're coming through with the virus, at the same time as they're sort of watching the ticker of how many cases, and they sort of can't get out ahead of either one of those things. So both both need to be taken with this grain of salt. If you're following it on a moment by moment basis, it's not going to be helpful, right? So to the Pfizer vaccine, and this is part of the New England Journal study, the only major side effect that happened in a group, in a large enough group to say that it was even present, is fatigue and malaise. So sort of tiredness, sort of like a flu-like feeling for the first 24 hours, and local reaction. So some people had some arm pain, things like that. There are some downstream things that people will discuss of neurologic complications, such as, Bell's palsy or anaphylaxis and things like this. That wasn't in the New England Journal article, meaning I can't say that actually was reported as an actual side effect. The other thing, and this is something I think is really important from the pediatric side, there's this pediatric condition that everyone's talking about. They're like, oh my gosh, I've never thought of a kid getting a virus and then being really sick afterwards. I think within science, and you would know too, right? And within sort of any sort of mental health, anything, we know that these things exist. We know things that are now all of a sudden rearing their ugly heads. This is something we study. It's kind of what we do. Now we're letting people in on this. And so we know the counts, we know all of these things, and now people are watching it. We also know some of these downstream problems happen with vaccines, and it's difficult to say if it's even the vaccine. It could be something in the shot itself that you might be allergic to, or any sort of immune response, which is exactly what you need a vaccine to do, can cause this autoimmune response and cause problems. But I didn't see anything that I can speak to at this point. Oh, there is one question about the vaccine that just popped up as we were talking about it. So I think it's an okay time, if that's all right. From what I've seen, one of the things that's really important is that this is a sort of a laboratory protein made vaccine. And so really your allergy profile should be discussed with your doctor before you do anything. But it's not made in an egg. It's not cultured in anything. So there's not any specific risk based on any pre-existing allergy that you have. So certainly if you have anaphylaxis, which is, sort of that severe allergy to anything, you need to go and see your doctor.
Ken, I got a question that came in to me, also involving the vaccine. So
Sure.
I'll just throw that out there right now. Someone is saying, is it true that you can't drink alcohol for 40 days after the vaccine? That I had not heard until
So I watched a
questions.
little infomercial. There's some obviously like continuing medical education stuff, and within emergency medicine, there's this group that puts some stuff forward, and that is absolutely not something they discussed. So I would say that is not, this isn't a tuberculosis treatment, which is, something that you would actually have to avoid alcohol for. But, I have not seen that.
Dr. Perry, I have another question here. There's discussions of, if I get COVID, can I get it again? And, I've heard mixed reports from the Department of Health of there's 2 months, 3 months, as we continue to learn and evolve through the information that we're getting. Do you have any insight on if you get it, can you get it again? How long does it take? What steps can people take in those situations?
At this point, we do know that there have been some reinfections. There are some people who initially had an infection back in March or April, and for whatever reason, they had a reinfection soon thereafter. There are plenty of patients who have been symptomatic with COVID. They go and get their antibodies checked. They show antibodies. And then as they're donating plasma, which is one of the other treatments that has come up, they realize that their antibodies drop down pretty quickly. The difficulty is we just don't know if your reinfection is going to be worse, the same, or far more mild. And I don't really see that I can answer that one way or the other, because there's, even the vaccine's only 2 months out, right? We're only 2 months from this study. I can't really say one way or the other. That being said, with the vaccine, the research was not done on patients who had previously had COVID, right? In the sense of like, they didn't have immune studies proving that they had antibodies. So that jury is still out as well. So I would say anyone who's had it and is looking at getting the vaccine, this has to be a really in-depth conversation with your doctor with a sort of a knowledge base, and might even, depending on whether or not you're in a real high risk pool, whether or not you want to bring in an infectious disease doctor. This is just so new that seeking out sort of further evidence on this, I think, is an appropriate next step as well.
So can I ask a question following up with that?
Yeah.
So does that speak to, because the antibodies, are they don't last that long possibly, does that speak to the fact that we might be living with this virus for quite some time, for years to come, and we have to figure out a way to live with this?
And I think that's a great point. I think that's why we're hoping that this vaccine keeps that antibody, that is the sort of the antibody that keeps you from having an underlying reinfection. We're hoping that causes the antibody to stay higher. There's some thought that we're looking for one specific antibody, but obviously coronavirus, which is a family of viruses, right? We're exposed to that all the time. It's one of the common colds that you get. So you might actually, if there was these discussions of whether or not having been exposed to a coronavirus of any sort gives you a little bit of immunity to it. And so that's really what science is still looking for, right? So whether or not you've had it and you have this underlying innate immunity that's not based off of a specific COVID-19 immunity, but that's just not known at this point.
Thank you, Ken. I have kind of a detailed question that came in to me by email that speaks kind of specifically to our city of Cranston, but I think that we can open it up and have a bigger discussion. We kind of touched on a few of these things, but I think it's actually really important in my opinion. So the question is, how can we get our city leadership to speak more openly and forcefully about the simple things people can do every day to protect the whole community? A lot of people are listening to false information, and our Republican mayor and mayor-elect could be out every day dispelling dangerous myths. For example, the virus is real, people are dying, and there's very easy things we can be doing, like wearing masks and not gathering indoors to help us all. Perhaps some people don't want to listen to the governor because she's a Democrat, but maybe they would listen to our incoming and outcoming Republican leaders. As a Republican on this call, and with Ed, I think that I am of the opinion that the more divisive we make this, the worse the health outcomes are for everyone. So I think I'd really like to know how you can speak to that.
You want to take that, Alex, or you want me to take that one?
Oh, I thought that was a question for Ed. I think we're doing it right now.
Oh,
I think we're doing it right now. I think this is perfect. I think we need, the lieutenant governor was saying, again, I'll echo it one more time. I think it's great that we're getting out there doing grassroots campaigns, engaging the community, having conversations like this, having these discussions and dispelling those myths. This is exactly what needs to happen in terms of pushing away some of that misinformation that's out there at this point, and coming from respected leaders in the community who are Republicans. I think that's good as well, because I feel like a lot of people are looking at Democrats and saying that they're more of the conservative when it comes to this virus, and information comes from Republicans as well, and we kind of identify a unified front. I think people start to co-sign on that a little bit more.
Yeah, I'll add a little bit into that one too, just kind of like to build on what I was talking about before. So I had a conversation with the George Wiley Center. George Wiley Center is like a Blackstone Valley center that helps people with heating assistance, rent, food. And I said, how big is your constituency? And he said, I got 7,000 people I can directly contact. So coming from, and I'm a former mayor. So coming from a mayor at this point into the community is all well and good. But if I say it, it's not necessarily true. But if the George Wiley Center says it to their 7,000 people, and the church says it to their 2,500 people in their congregation, and the The Rotary Club says that to who they contact to. And this is what I think is missing right now. As I said before, when I was a mayor on the 9/11, reached out to the clergy, reached out to different factions of the town. There was an organic response that was community building. And I think the question that was being asked, Councilwoman-Elect, really indicates to the fact that you need this community response. And then and in order to get the community response, you actually have to work at it. It doesn't happen just because it should happen. In this case, and as Dr. Turchetta said earlier, this is not a red and blue issue. This is not a political issue. So my belief is that if you were able to get communities, and leaders have to be a part of it because they need to weigh in on agreeing on what the message needs to be, and then you can have community-based distribution of that information so it's consistent. Both the head of the hospital down in Westerly and the superintendent of schools in Westerly and the chief of police in Westerly all are leaders, and they all agreed that it has to be a consistent message. So just having me go around saying what I think needs to be done, or another Democrat saying it, or another Republican saying it, if you don't have buy-in from the ground up at this point in time, I don't think you're going to get it. I think that you're going to get more of a directive. Like if I said as a mayor, okay, this is what we're going to do, then in a lot of ways that's going to be interpreted as a demand on what we're going to do, right? And so building this grassroots strategy right now, Councilwoman, to the person who's asking that question is so important right now. I mean, it's just critically important. And as Ed said, we're definitely dealing with all the issues that Dr. Turchetta said and Dr. Perry said in terms of the emotional issues and that type of thing. The health issues, I think that clearly is an issue. But the economic issues that Ed's talking about are clearly issues that need to be dealt with. So my feeling is create a strategy in every community, and we're going to start it. We're going, like I said, we're in Westerly, which is the southern part of the state, and we're going to be in Central Falls next week with Mayor-elect Rivera and Mayor Diosa. But I want them to sit and listen to the Progressive Latino, the church groups, the Little League group, the soccer group, the school leadership. And I think that's what I think is lacking right now. And I believe that it's worth the effort if we were able to figure out a way to create that grassroots strategy and a bottom-up influence that supports the top-down guidance.
Lieutenant Governor, I couldn't agree with you more. And I'm looking forward to having that conversation here in Cranston. I believe we scheduled it for the 18th. I talked to your office today, and continuing to spread the message, continuing to unify, to continue to educate. And I truly appreciate all your work on this effort for the small business community, for everyone. You're gaining our trust every day by just being out there elbow to elbow with us in our community. Like we've touched base on many times in this conversation, Republican, Democrat, doesn't matter to me. We're all fighting this war together to get through this. So I truly appreciate your continued efforts. I know Dr. Perry has to head to the hospital very shortly. Dr. Turchetta, I appreciate your obviously respected input regarding the mind, the soul, how we all can continue to get through this. Councilwoman-Elect, did you have anything else you want to touch base on before we let Mr. Perry go? We can certainly continue this conversation for a few more minutes.
I did want to say that Dr. Turchetta is going to send me some information that I will put out into the community of different resources that people can go to, so they can consult with and figure out what they need to do, or where they can go if they have questions to ask or find therapy. There's been some teachers that have asked for resources to use within their classrooms for health. And he was kind enough to say he will get me that. So I will get that out on our Facebooks and hopefully up on the website and wherever else we can. And if more questions do come in after we're done here, I'll do my best to get answers from the panel and get that information out there.
Yeah, and sorry,
Anyone else want to touch base on it?
I got to jump off. I'm so sorry. The night shift this evening, but I think, one of the things that's nice about this is that there's something about hearing the same information that's been out there, but knowing from whom you're receiving it, right? So hearing about anxiety and things from someone that like Dr. Turchetta, or, hearing about the vaccine and things like that from someone that you remember from high school, I think that actually really leads to it. And people don't like being spoken to, that sort of Hunger Games style, who lives in the capital, who's living out in the districts. That's really what people don't like. They want to hear the information and know that there's good and bad to all these things, and they just want to be sure that they can trust the people. And I don't have a constituency, so I'm just going to answer the science question. So that's so much easier at this point. I'll stick to that. But thanks very much, guys.
Thanks so much, Ken.
Thank you,
Good seeing
Dr.
you, Ken.
Perry. Appreciate it.
Yeah, thank you, Doctor.
Dr. Turchetta, did you want to touch base on any additional tips that you want to leave people with? Nicole, did you have any additional questions before we sign off here shortly?
Yeah, I got the same question a few times.
Yeah,
Alex, I'd love to know your opinion. A lot of people are,
Sure.
Talking about the closing of gyms and how gyms, not working out not only increases, immunity, but just the mental aspect of being able to work out and go into your gym. For a lot of people, that is like a home away from home. So
Sure.
I'm curious, and a lot of people have been asking about that.
Yeah, I mean, trust me. I know firsthand. Gym is my therapy. So going to the gym and getting that stress out, and it's a cathartic experience, and people need that stress reliever. And the fact that it's closed right now is really weighing on it's weighing on people's mental health. It's stressful for people, and also the gym can be an exercise is a place where you can build your immune system. So people are missing that aspect, so the mental aspect as well as the physical aspect of things. So I think people are really missing that at this point, and we're really kind of anxious to get that back in our lives. What you can do in the meantime, there's a ton of things that we can do at home, whether that's yoga, going for a walk, going for a walk with the kids, playing games with the kids. I'm sure they run you ragged, Nicole. Yes, I've seen them out on the track with you. So doing those things and making sure that you're setting up a schedule for yourself to maintain that level of activity and holding yourself accountable. And whether that's if you can't do it yourself, have someone else hold you accountable. Whether that's, you can say, hey, give a friend $100 and say, every time I don't exercise here, take $10 of that, hold yourself accountable with that, and making sure that you're exercising, because, exercise is very much tied to your mental health. And it's super important to, continue that, even though, gyms and big box gyms and smaller gyms and all those places are closed at this point.
Alex, Dr. Turchetta, I think that's important because, finding balance in anything in times of turmoil is crucially important. We have a lot to be upset about right now. We have a lot to be mad about. We have, businesses are closed and teachers are crying. We've talked about this earlier. Healthcare professionals are overworked. There's certainly a lot of stresses going on the everyday mind, but keeping the balance and trying to find joy through all this craziness, is crucially important. So I appreciate your time tonight. I appreciate you answering all the questions. I know you have to go shortly. Also, Lieutenant Governor, did you want to leave our community with any thoughts or any lasting words there? I certainly want to continue to do more of these forums. I'm looking forward to our work, continuing to work together here in the community, but wasn't sure if you want to leave us with any lasting thoughts.
No, I think that even there was a question that just was asked. I think that there's no one right answer. There's no one right strategy. So, in our personal lives, we're dealing with individuals. I would say that we need to, have a certain amount of empathy and try to understand. It's a difficult time, and I think understanding at this point is far better at this point in time than any level of insistence or demands. And then on as far as community leaders like yourself and Councilwoman-Elect, I do think that we have a responsibility to start listening better to the people who live in our communities and the people who are, have influence. That George Wiley Center with those 7,000 people, they trust that leadership, right? So why aren't we talking to those leaders that have large groups of people that trust them? Just as the two docs talked about, that element of trust right now, that's gold. And we should be out there as community leaders, whether state leaders, local leaders. I've been a local leader as well. And we should be really listening. And there's a difference between talking to someone and talking with someone. And we need to start talking with people. Right.
Couldn't agree more, Lieutenant
Sure.
Governor. Nicole, did you want to leave any lasting thoughts?
I just wanted to say thank you, everyone, for being here tonight and for having this conversation. I think that it is very important. And as a new leader in the community, I seek to be very involved. I'm involved in the schools because I coach kids who I'm talking to every day who, when I coach them in track. So their physical health is important to them. And I'm trying to train them virtually and get creative, but their mental health is really important too. They're kids and they're missing out on a lot. And I try and tell them to give each other grace. I think that's something that, we can all give to each other and assume positive intent. I don't think, anyone wants anyone to get sick. And we're all just, fighting our own battle at home. No one knows what's going on in someone else's life. So just, to be kind and try and help each other, lend a helping hand versus point a finger. And, that's the method I'm trying to go with. And I hope I can continue to work with people like you who I think are looking for the same thing.
Thank you, Councilwoman. I appreciate it. And we have to uplift these all together. We'll continue to communicate, continue to work together and continue to be out there, putting the time in. I know it's exhausting, but I truly appreciate everybody in this world who's continuing to go on, who's going through their own daily struggles and are working through this virus. So, Lieutenant Governor, I truly appreciate your time on the call tonight. It's very much appreciated. Dr. Turchetta, thank you so much for your insight for our community. Like Nicole
Thanks
said,
for having me.
I certainly know we're going to have a lot more questions, and we'll certainly be utilizing you as a resource. And we're very proud of you as a Cranstonian, of your continued success. And thank you for helping so many minds get through these troublesome times. And again, Councilwoman Renzulli, thank you so much for your already efforts that are great. You're a passionate person. I'm looking forward to working with you so much on the council level. So I appreciate all your time tonight.
All right. Thank you.
Good night.
Night, guys.
All right. Thanks, guys.
Yeah, thank you, Ben.